Okay, so today was the big day. I had my Sesamoidectomy on the lateral sesamoid of my right foot. I haven't felt any pain yet, hardly at all, so that's good. But I'm sure I will at some point. I still can't feel anything from the knee down. It's very interesting. But I guess just to give a little recap, I got up around 6:30 in the morning and I was due to arrive at the operation facility. It wasn't a hospital, it was just a facility specifically for this particular orthopedic practice. And we got there at 7:15 and they said it was going to be 2 hours before I actually got operated on, and at first I thought, oh god, like this sucks, I'm going to have to wait around for a long time, but it turned out there was a lot of pre-operative processing they had to do, and so the time went by kind of fast. In fact, it went faster as the day wore on. At first I came in and I was hungry and thirsty. Of course, I'd been fasting for about 9-10 hours at this point. I hadn't eaten or drank anything, so I was wicked dehydrated, and I had like a really bad headache from the dehydration. I get headaches when I'm dehydrated, and so luckily the nurse was nice enough to actually give me some liquid aspirin in the liquid that they put in my arm through the IV before the operation. The only pain I really felt at all was the needle going into my wrist to numb the IV area that they would then insert the IV. So I suppose that's lucky for now. As I got fluids, I just started feeling a lot better, and the aspirin, my headache went away, and I just felt a lot better in general. The surgeon came by and talked to me about what, obviously what he was going to be doing. There was a lot of people making me confirm which foot they were operating on. I was thinking about maybe making a joke about, oh gosh, that's the wrong foot afterwards, but I guess that wouldn't be funny. He informed me that they're going to be taking out both sesamoids. Actually, you're supposed to have 2 sesamoids. I actually have 3. So the medial sesamoid, kind of in the middle of the foot, that's not a problem. They didn't take that one out. But the lateral sesamoid, or the tibial sesamoid, on the side of the foot, on the inner side of the foot, there was actually 2 of them in there. And I explained in the last video, I was either born with 2 of them, or I was born with one that was twice as big as it was supposed to be, and it cracked in half at some point. So they were both in there kind of rubbing up against each other, causing nerve pain and that sort of thing. And he just said, we're just going to take both of them out. I said, okay. I was a little bit worried about that. I didn't realize that at first. I thought he was just going to take one of them out. But basically one of the other podiatrists that I had seen before told me I couldn't get this surgery because if I got it, it would fuck up the tendons and I would lose the ability to move my big toe, which is really important for balance and whatnot. So I was kind of worried about that. He said that shouldn't be an issue, and I'm hoping he's right. He seemed very professional. The guy does a lot of surgeries every year. I think something like 700 surgeries a year. He has stellar reviews, so I'm not too worried. But so that was explained to me, and they told me they're going to put a nerve block in. I've never heard of a nerve block, but I guess it just whatever they did, they put me under for this. I was actually put under not 1 but 2 times. The first time I was put under was for the nerve block. They had me turn over on my stomach in the bed that I was in, and they put me out totally. And when I woke up, I could not feel my leg from the knee down, and I still cannot feel my leg from the knee down. It's the darndest thing. Like if I reach down and touch it, it's like I'm touching somebody else's leg. It's kind of creepy. But that's probably a good thing, because I bet I'd be in a lot of pain right now if that wasn't the case. But anyway, after they put the nerve block in, I woke up. Next thing I knew, I woke up. I came to, and I was being kind of wheeled down a corridor into the operation room, and there were a lot of people in there, more than I expected. There was maybe 4 nurses, a PA, and the surgeon himself. And then I asked if I could keep the bone, because I thought it would be kind of interesting to look at. Maybe some people think I'm weird for that, but I kept my wisdom teeth when they were pulled out last year, so. Anyway, they gave me some oxygen to breathe, just pure oxygen, and I mean, that was okay. And then they added anesthesia to the oxygen that I was breathing in, and I was out like a light. And next thing I knew, it was over. I had no feel. I still had no feeling. It was almost as if it had never happened. I just had a bandage on my foot, and trying to think. I was a little bit loopy from the medication. That's normal. But supposedly it's like a 45-minute to an hour-long surgery, you know, which I don't know what the average is for surgeries on the foot, including, you know, regarding bones and whatnot. So I don't know if this is faster than average or not, but that 1 hour went by really effing quick. I'm thankful for that. So after I woke up, I came to. It was out I haven't even seen the incision yet. I'm wrapped up in a cotton dressing. They told me not to undress it. They told me to keep it high and dry. That is the rule. So I've been keeping it elevated in a post-operation boot. Actually, I'll just grab the camera and show what it is. So the dressing this is the dressing. I guess the incision was somewhere in here, but they had me in this boot, and they don't want me putting any weight on. They said I could probably put a little bit of weight on my heel if I have to, and I may have, crutching my way to the bathroom. Obviously I can't feel it, so I'm pretty sure I've been pretty good about keeping all my weight off of it, but the dressing goes all the way up to here. And this feels like somebody else's leg right now. It's the craziest thing. So I was kind of looking forward to just kind of sitting on my computer and playing video games, but that's going to have to wait for a few days at least, because I'm supposed to just totally keep this elevated and totally stay off it as much as possible. And I don't know how bad the pain is going to be. If the pain's really bad, that'll be a lot easier to comply with, I think. But if I basically feel normal, with the exception of not feeling myself from the knee down. So I almost like want to do stuff, but I mean, it's tough to move around. But came home, I ate some lunch, answered some emails, that type of thing. It's going to be a lot of that over the next 8 to 12 weeks. The surgeon said that it'll probably be about 8 weeks before I start feeling kind of normal again, and before I start doing any kind of recreational walking, which is kind of a bummer, but it is what it is. He said that 12 to 13, maybe even 14 weeks would be a very realistic expectation for being cleared to work, which is handy. It works out because the company I work for, because of my tenure, they give me short-term disability payments while I'm out of work. So I mentioned the other guy on YouTube who made a pretty long series of videos about his sesamoidectomy. It looked like he had to return to work in like a month. Not sure what he did, but I do kind of manual labor at a factory setting for a newspaper in my area. So it's going to be really tough to totally return to all the duties that were expected of me very quickly. It's probably going to be something like 3 months, which is a bummer, but it is what it is. Again, I feel pretty lucky that my company is willing to give me short-term disability. It's like 50% of my paycheck for about 12 weeks or so. So, you know, It's not the best case scenario, but there's certainly much. They could have given me a lot less, so I'm thankful for what they're giving me. I was given a whole laundry list of medications I got to do. Apparently, blood clots are kind of a concern post-op with this type of surgery, so they're having me take aspirin every day for the first couple of weeks. Some pain medication, Mobic, take in the morning. Gabapentin I take in the night, the first 7 days for both of those. It's funny, actually, one of my dogs is on gabapentin, so I guess I'll be joining the club. They want me just doing, they want me to do like 1 to 2 oxycodones every 4 to 6 hours. I think I'm going to try and avoid this at first if I can. I don't want to kind of get into that whole pain pill situation. So I'm going to try and get away with ibuprofen and Tylenol if I can. If the pain is just too excruciating, I'll just go to the oxys. But just because of what they are and the ongoing crisis in the country, you know, with this kind of addiction and stuff like that, I kind of have an addictive personality too, so I'd like to kind of steer clear of those if I can, but, you know, I will if I have to. But this is just the first day in a long road to recovery. Surgeon said that the operation went fine, there was no complications. Unfortunately, I didn't get to keep the bone, but, you know, whatever. So I guess that's update number 2. Or video number 2, update 1 on the sesamoidectomy surgery that I just got, and I'll probably do one every day for, you know, a week or so or something like that, and kind of taper off because it'll get boring, I guess, after a while. But I guess I'll make another video when I start feeling pain. How about that? And thank you so much for watching. I hope there's somebody else out there who this can help. Till later.